Hello everyone, my name is Cristina Montoya. I'm a dietitian and a person living with Sjögren's disease and rheumatoid arthritis. Today I'm wearing my patient's hat to share with you a few highlights from the session I attended on day 2 on the novel imaging and therapeutics in Sjögren's syndrome. This is part of the Go With Us to Conferences program led by AiArthritis, short for International Foundation Autoimmune and Autoinflammatory Arthritis. So let's start with Dr. Alan Bear. Dr. Bear is the director of the Jerome L. Green Sjögren's Disease Center at Johns Hopkins University School of Medicine. He presented on the challenges for disease modifying therapy in Sjögren's disease. So I just wanted to clarify that you might see the name Sjögren's syndrome, but remember that Sjögren's, the name was just officially changed this year. So when these sessions were submitted in 2023, it was still considered Sjögren's syndrome. So please don't get upset. Now, this session's objective was to understand the fundamental tension between Sjögren's disease modification and symptom relief in Sjögren's clinical trial designs. Dr. Bear shared how Sjögren's disease has high morbidity and a high burden to the patient that included not only the Zika symptoms of dry eyes, nose, mouth, and skin, and everywhere else, but also fatigue, morning stiffness, trouble sleeping, muscle and joint pain, and brain fog. He highlighted what patients want from a new systemic treatment. Patients want a better management of day-to-day symptoms like fatigue, muscle, joint pain, dryness, neuropathy, and dysautonomia. Patients want to reduce Sjögren's flare-ups. They want to reduce the risk of long-term concerns like extreme dryness or lymphoma, and stop medications like prednisone and other chronic medications. But what are the challenges on developing medications that can modify the disease? The main problem is that there is a poor correlation between the disease activity, which is measured by the SDAI, or what is short for Euler-Sjögren Syndrome Disease Activity Index, and the Symptom Burden Index that is measured by the ESPRI, which is the Euler-Sjögren Syndrome Patient Reported Index. There's also challenges in monitor the salivary and gland dysfunction when it's already too advanced, when the patient is diagnosed, and it may not be reversible. And another challenge will be that the disease progression is very slow compared to other rheumatic diseases. So that poses a challenge when they're doing clinical trials, because maybe the time is just not enough to see the positive side effects. Dr. Bear also stated that unfortunately the scores used to measure the disease activity do not fully capture the disease systemic involvement. So according to the SDAI, 15% of patients will develop severe systemic disease, but up to 50% of patients can develop systemic manifestations in other autoimmune diseases over 10 to 20 years. So you see, it's like varies. And that also interferes with early diagnosis and detection of the disease. The current limitation of clinical trials is that they target select populations. They do not include seronegative patients, or at least not for now. And they identify that there is a robust placebo effect. So they need to decipher whether is the effect from the medication or is the placebo effect. In some studies, although there is a statistically significant response, it is not always reflected on how the patients feel, meaning that the biologic effects do not translate into the clinical effects. He said that it's possible that patients need that extra time in those trials for the effect to be seen. So better outcomes could be obtained if there were better tools to exclude the non-autoimmune Zika, if there were tools to predict the evolution of Sjögren's with those with Zika and or anti-SSA positivity, and a better understanding of the symptom etiology. As a patient, I felt validated by Dr. Baer because he explained the barriers and limitations, and he also shared what are the patient's expectations from these clinical trials. So I truly appreciated this session. The next one was on the novel imaging to diagnose Sjögren syndrome, cutting edge techniques. So this one was by Dr. Hosevar from Slovenia. And just like I said on the title, it says Sjögren syndrome, but then she right from the get-go, she said, I'm going to talk about Sjögren's disease. So that was very validating as well. This one was a little bit over my head because there was a lot. They were just basically talking about advancing and utilizing the ultrasound of salivary glands to diagnose and potentially evaluate the progression of the disease. Because she indicated that to this date, we don't have 100% sensitivity diagnostic test, or diagnostic criteria for Sjögren's, which delays the diagnosis and treatment. As we all know, basically the doctors utilize the classification criteria, which is not the same as a diagnosis criteria because technically it doesn't exist yet. So it takes a full expert, a clinician's expertise to see the patients holistically beyond Zika symptoms. She explained that using the ultrasound of the salivary glands and also MRI in Sialendoscopy, so basically it's just an endoscopy that goes directly into the salivary gland, could potentially determine or detect the Sjögren's disease a little bit earlier. But despite these potential imaging techniques for diagnosing Sjögren, to make the Sjögren's diagnosis, there must be a comprehensive clinical, histological, imaging test to confirm the diagnosis and not just to rely on the testing of the salivary glands, especially when the results are not conclusive. Remember that a lot of patients, because the disease progresses so slowly, they do not present the histological changes in the salivary glands. Unfortunately, as a patient, I saw that the new testing, again, is very focused on the salivary glands and not on the systemic involvement of the disease. And the last session was presented by Dr. George Bruin from the Netherlands. And it was quite funny. It was also very interesting because he walked us through all the clinical trials that have been conducted on Sjögren's for the past 20 years, I will say. And what I could determine is basically all of them had failed, that they move into like phase 2, and then when basically says there's no significant changes on symptom burden or biological changes. There was someone in the audience with Dr. Bookman. He is our Sjögren's expert in Canada. And he asked, and specifically said, maybe we're just not giving enough time to these trials and enough time to the patients to feel the real effects. They also talked about that perhaps we are still identifying what are the immune cells that they need to target in Sjögren's. So currently there are over 20 clinical trials on patients with Sjögren's, which is really revolutionary and is very neat. 3 are currently in phase 3, meaning that now they're expanding the results to a larger population. The good news is that pharmaceutical companies prioritize drugs for autoimmune diseases. This means that, but still we need to be like cautiously optimistic, really indicated, let's not promise anything to the patients yet. We have to see the results of these clinical trials. My takeaway from this session is that at least one clinical trial is showing some early positive results and moving to phase 3. But overall, I saw more abstracts and scientific sessions on Sjögren's than any other years. And I couldn't even enter one of the sessions on Saturday because there was an overflow of people wanting to learn more about Sjögren's. So I can see the light when it comes to Sjögren's disease. So I hope this was helpful for you, and I'll give you another update tonight or tomorrow. Bye.